Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. We'll be speaking with Tiffany DeWitt and Dr. Suela Sulo in this segment. They're going to talk about the hidden health condition that baby boomers should have on their radar and how a simple nutrition care program can improve older adults' nutritional status, giving some very good health benefits like psychological well-being, quality of life, cognitive function, and physical functionality. Welcome to Health Professional Radio, both Dr. Suela Sulo and Tiffany DeWitt. Thank you both for joining us this morning.
Thank you, Neil, for having us.
Dr. Sulo, if you tell us a bit about yourself and briefly, and then Tiffany, if you do the same.
Yes. Hi, Neil. I'm Suela Sulo. I'm a health outcomes researcher with Abbott. I am currently leading the health economics, outcomes research, and policy work for Abbott's Global Nutrition Research and Development, and also served as one of the lead investigators of the study that we'll be discussing today.
And Tiffany.
Hi. Yes. Hi there. My name is Tiffany DeWitt, and I am a registered dietitian. And I provide clinical and scientific support for the nutrition products here at Abbott.
As baby boomers continue to age, what should we be looking for? What should we be aware of when it comes to our health?
The global population of older people, 60 years and older, is predicted to double over the next 3 decades. It's estimated to be over 2 billion by 2050. And with the aging process, older people are experiencing less independence, adjusting to new health concerns, or dealing with social isolations. All of this can strongly impact physical and psychological well-being. But when we think about the aging process, a lot of times we think about common chronic conditions such as diabetes and heart disease. But a very common condition, which occurs in up to 1 in 3 older adults, is malnutrition. Malnutrition occurs when the body doesn't get the right nutrients that it needs, whether it's vitamins, minerals, and it can take many forms. It can present itself as undernutrition in the underweight individuals or overnutrition in the overweight and obese patients. And malnutrition alone can have a very negative impact on someone's physical function, quality of life. It can impact their survival as well. But then when you combine it with those other chronic conditions such as diabetes and heart disease, then we're talking about people having an increased mortality rate, being more likely to be hospitalized, be readmitted, and incur additional healthcare costs. So when we talk about older people who want to stay independent, aging well means not only taking care of their physical and psychological well-being, but also thinking of nutrition as fundamental for aging and aging well.
Is malnutrition the main factor here? And if so, why is it that older people are at greater risk for malnutrition?
Yes, so as we age and as we might experience, our bodies and our nutrition requirements change. Whether it be for us or for a caregiver, it's important to be mindful of this and focus on eating well and, most importantly, too, regular exercise for healthy aging. So one reason people might be at risk for malnutrition is that older people sometimes experience poor appetite. This can affect 15 to 30% of older people. And this could be for a variety of reasons. You might experience lack of appetite due to changes in taste, smell, or even chewing ability that occur naturally with age, but it also can be a result of maybe medications or a recent illness that someone has had. But regardless of the reason, it's important to be mindful of this and accepting so that you can eat through these changes to help you get the nutrition that you need. A few other reasons that older people may not get the nutrients that they need is maybe a lack of energy or a lack of motivation to shop for and prepare nutritious foods. And at that same time that that's happening, there's requirements for specific nutrients such as calcium or vitamin D for bone health increase later in life, and it becomes maybe a little bit more challenging to get in all of the protein that you need to maintain your muscle health. So it's really just important to be aware of these changes and so that you can make proper mealtime choices, even if you or the person that you're caring for is not really having a very robust appetite.
So what are some strategies that health professionals can use to identify and treat this malnutrition and its risk in older folks?
And so we conducted new research in partnership with the University and Health System in Bogota, Colombia, which was supported by Abbott. And we were able to demonstrate that identifying and addressing malnutrition among older people that present for care after a hospitalization or for chronic disease management, we can see improvements in outcomes as a result of optimizing their nutrition care through a personalized nutrition care program that involves 3 very simple steps. In fact, just a little bit about the study. The study is informed with very simple but comprehensive steps, which includes that of screening and identifying if someone is at risk for malnutrition or malnourished. If you identify that someone is at risk, then we provide a customized nutritional action plan, which will include not only education for the patients themselves, but also for the caregivers, provide dietary consultation and exercise counseling, as well as oral nutritional supplements. And in order to optimize nutrition care over a period of time, we follow these patients, and in this case, we follow the patients either in person or via telehealth visit for over 90 days. What do we see is that more than half of the study participants saw improvement in their nutritional status. Significant number of patients saw improvement or maintenance of good body mass index, body weight, muscle health. And these improvements then in turn led to improvements in physical functionality, psychological well-being, cognitive function, and all of these improvements combined ensure that patients were less likely to be seen in the hospital, less likely to be seen in the emergency room, or have multiple outpatient clinic visits. So therefore, we see this overarching improvement in their quality of life, which improves health outcomes, reduces healthcare costs because patients are recovering in the comfort of home rather than being seen in a clinic or in a hospital setting. So when we look at this study, it's quite novel. It's not only a first of its kind study for Latin America. We have done similar studies and programs in the United States and have been found similar findings, similar results in terms of improved outcomes for people in the hospital, in home health, in outpatient clinic. But what's unique about this particular one is that we can demonstrate now for the first time that a comprehensive nutrition care program is very effective when it's implemented both in person as well as virtually via telehealth visits, which is quite important nowadays given the current hybrid nature of life as a result of COVID-19.
We talked about some strategies that health professionals can use, but you mentioned being taken care of at home. What are some steps that caregivers, in conjunction with older adults working together, what are some steps they can take to reduce malnutrition?
So as a dietitian, I'm going to say that prioritizing good nutrition can go a really long way for older adults and even caregivers. And so it's improving those dietary choices every day, and it doesn't necessarily have to be difficult. Right. So first, how do we reduce malnutrition? Right. So it's number one is being aware of some of the symptoms. As Suela mentioned, sometimes malnutrition is common, but it's not always top of mind. So your adults or even caregivers, sometimes your nutritional status can fluctuate. It can change based on those different circumstances, such as maybe having a recent illness or even a hospitalization. And so watch out for things like decreased energy and even unintentional weight loss, as that can be a sign that something's wrong with your nutrition status. And if you're seeing those types of symptoms, consult an expert as soon as possible. And so ask whether it be your primary care physician, ask to see a registered dietitian who can really help assess your status a little bit more and provide a personalized nutrition care program. And also, as Suela mentioned, we know that when people are in a comprehensive program and really getting personalized nutrition care, it can help them support or even recover the way that they need to recover. So in the meantime, though, it's important to do a few simple steps, right? So every day you can eat plenty of nutrient-rich foods. So even if you're experiencing or the older adult that you're caring for is experiencing a lower appetite, you can select foods that are high in nutrients like fruits, vegetables, whole grains, dairy, lean proteins, nuts, and seeds. And I will kind of emphasize as well to prioritize protein. So starting at the age of 40, we can lose up to 8% of our muscle mass. And this rate can even double starting at age 70. And so it's important, as I mentioned at the beginning, too, to focus on exercise and to make sure you're incorporating those protein-rich foods that can help you maintain your muscle mass. One other thing is considering nutritional drinks. So oral nutrition supplements can provide complete balanced nutrition and can help older adults or even caregivers get the nutrients they need every day. So somebody that's at risk of nutrition or malnutrition or even has malnutrition, if you're consuming oral nutrition supplements in addition to your regular daily meals like Ensure or Glucerna, you're more likely to see improvements in your nutritional status. So it's simple things every day that can help you maintain your nutrition.
Well, give us a website where our listeners can learn more, if you would.
Yeah, so for more information, I encourage you to visit Healthy Aging tab on nutritionnews.abbott.
Dr. Sulo, Tiffany, I appreciate both of you joining us here on Health Professional Radio this morning, lending us some of your time. It's been a pleasure speaking with you, and I'm hoping that you'll return.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.